I
Good morning, good afternoon, everyone. Thank you for joining us this morning. My name is Chandra Sawyer, and I'm the Healthcare Wellness Specialist here at the National Health Insurance Authority. This morning, we are here to speak about cervical cancer awareness. Just wanted to go over the agenda for this afternoon. We're going to focus on who are we here at the National Health Insurance Authority, and we would introduce our guest speaker in the person of Dr. Inga Smith-Pratt. There's going to be opportunity to ask Dr. Pratt questions at the end of a presentation, and so you can place your question either in the chat feature or the question answer feature in our Zoom chat. If you're watching us via Facebook Live, feel free to place your question in the comment feature under the video. So who are we? At the National Health Insurance Authority, our vision statement is to lead the way in providing access to affordable, quality health care that Bahamians deserve. Our mission statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. If you continue to look on our screen, our core values consist of we are passionate about bringing universal health care to all Bahamians. We are progressive, and we are progressive in providing solutions supported by technology in the healthcare sector. We thrive on partnerships, and so we are dedicated to delivering affordable healthcare through partnerships. We operate with integrity, and so we are committed to doing business with integrity, accountability, transparency, and sincerity. And we promote respect. We honor our beneficiaries by providing care and respect in all aspects of our service. And so our focus here at the National Health Insurance Bahamas and our wellness program, we are dedicated to creating a platform where our beneficiaries, as well as the public at large, are encouraged and educated on adopting healthy lifestyles by incorporating exercise and physical activity into their daily routine. We want them to understand that their food should be their medicine. And we also want to focus on mental, emotional, and spiritual health. The whole goal is to promote the importance of living a well-balanced life, which ultimately leads to enhancing the overall health and well-being of our nation. And so here is where we are now in the NHI Bahamas program. We are committed to leading the way in providing access to affordable, quality health care since our inception in 2017. And so we can boast that our enrollment growth is over 156,000 plus Bahamian citizens and residents. Our demographic is very diverse, and currently Bahamians and residents enrolled in the program hail from more than 17 islands. And just a little bit of a breakdown, 7,000 plus Bahamians are under the age of 5. There's more than 30,000 school-aged children and 19,000 plus Bahamians and residents enrolled in the program over the age of 65. 96% of our beneficiaries have indicated to us that they are satisfied with the service that they are receiving in the program. Our provider network is very expansive. There are currently 137 physicians, a part of our network, 79 primary care facilities across 7 islands, and 9 major labs with 16 locations are part of the NHI Bahamas program. We can also boast that our digitally enabled care through the electronic health record system is up and running for our beneficiaries, where they can receive their health records in an electronic format, and telehealth feature is also enabled for applicable visits. And some of our benefits, what is covered at the NHI Bahamas, in the NHI Bahamas program. Our conversation today is about cervical cancer, and so I just want to highlight those benefits that are in relation to cervical cancer awareness, particularly for the female population. Maternity care, which consists of pregnancy tests, prenatal doctor visits, lab testing, and screening for genetic characteristics, vaccines and immunizations, in particular the HPV vaccine, and cancer screening, particularly the pap smear. Cervical cancer. According to the HPV Information Center, managed by the Catalan Institute of Oncology and the International Agency for Research on Cancer, they produced a fact sheet in 2023 on Bahamas human papillomavirus and related cancers. And this fact sheet revealed that the Bahamas has a population of 174,074 women between the ages of 15 years and older who are at risk for developing cervical cancer. In 2023, the statistics also revealed that cervical cancer ranks as the third most frequent cancer among women in the Bahamas. It also further revealed that it is the fourth most frequent cancer among women between the ages of 15 and 44 years of age. This afternoon, our speaker, Dr. Inga Pratt, currently serves as a consultant in the Department of Obstetrics and Gynecology at the Princess Margaret Hospital and at Doctors Hospital. She is also the managing director of Advanced Health Center, which is her private practice. Her primary focus is disease prevention through timely screening and patient education, as well as minimally invasive surgery and laparoscopic surgery. Her impressive educational background includes being a fellow of the American College of Obstetrics and Gynecology. Dr. Pratt is married with 2 children, 3 dogs, a rabbit, and 2 turtles. This afternoon, we would like to welcome Dr. Inga Pratt as she speaks to us on the topic, Learn, Prevent, Screen, in honor of Cervical Cancer Awareness Month. Dr. Pratt, you are welcome.
Good morning. Good morning. Sorry, good afternoon. Thank you so much for that introduction, and thank you so much for having me. I appreciate this series because it really reaches out to everyone and allows them to gather information to hopefully help decrease non-communicable diseases in the Bahamas, as well as for a healthier population. Thank you for the kind introduction. And today, this is Cervical Cancer Awareness Month, and we're focusing primarily on cervical health. So before I give any talk, I have to let you guys know if I have any conflicts of interest or if anyone is paying me to do this, but I'm not, and this is purely for educational purposes. So I have nothing to disclose or no conflicts to disclose. So one of the benefits of the National Health Insurance Program are your annual Well Women visits. And those visits are primarily for health maintenance and screening, prevention of disease. So that's the primary focus. So these are some of the issues that we discuss when we have our Well Women visits. So birth control, cancer screening, vaccinations. We screen for mental health illnesses as well, sexually transmitted illness screening, menopausal symptoms, weight control. And we also check to see if patients are having a struggle in any particular area. Now, in terms of cancer screening, one of the things that we screen for would be cervical cancer, as previously stated. We also screen for ovarian cancer with the pelvic exam, as well as breast cancer with the breast exam. All right. Why is cervical cancer education so important? So essentially, cervical cancer in other parts of the world are being eradicated, meaning it's becoming very rare in native populations. So if you could see, the light blue represents where the incidence or the prevalence is low, and then the dark blue indicates where you have a lot of cervical cancer. And if you look at our island nation, we're in the zone where we have a high prevalence and a high incidence of cervical cancer. And that's for two reasons. One, because there's a vaccine to help prevent human papillomavirus, which causes cervical cancer, and that would have just been universally adopted in the Bahamas in the last 20 years, and we're increasing information about it. And also, we are also a population with increased risk factors for cervical cancer, one being increased weight, another being diabetes. So because we have risk factors, that increases our risk for cervical cancer. So I just wanted to go through where exactly is the cervix, okay? So this is a diagram of the female organs, and this is the uterus. This is where we have our bleeding from every month, and as well as this is the area that carries a fetus. These are fallopian tubes, and these are ovaries, okay? Most women have two ovaries, two fallopian tubes, and a uterus. So the uterus is divided into the uterus corpus or body and the uterine cervix. So we call this the neck of the womb, the cervix. This is what dilates when women go into labor. 1, 2. Sorry, 1 second. Oh. Okay. I'm trying to figure out how you could see me as well as the screen. Just present.
Hi, Dr. Pratt. If you share the screen, you would still come up because I have you spotlighted. So we'll see you as well as the screen.
So you can see me?
Yes, we can see you.
Okay, and you can see the pointer as well?
No, we can't see your screen, so you have to click on share screen, and then just click on your presentation and it'll come up.
Okay, I'm sorry, 1 second.
Okay.
Okay. Share the screen. Okay. Right. Okay, so can you see both me as well as the screen now? Hello?
No, it didn't change. We just can see you still.
Yeah, you can see those now. Okay. Okay, I can't see me, so if I get out of view, just let me know, okay? But, so we were going through the pelvis and the pelvis. Pardon me?
Sorry, Dr. Pratt. No, it's still not there. Are you able to email it to me? Because I can send it. I can share it for you as well.
Give me the email, please. Hello?
All right, give me 1 second, Dr. Pratt.
My apologies. While we're fixing this technical error, does anyone have any questions they'd like me to answer while we're waiting? Oh, Okay, can you see both now?
Yeah, so now you could just put it on slideshow.
Okay, yeah, you should be good.
And we are perfect. Thank you so much.
Sorry about that, guys. Okay,
It's fine.
all right. So you didn't see any of the presentation so far?
No, we haven't seen anything. So you
Okay.
may want to go back. Yeah.
Okay. So I don't have to go all the way back. So I just wanted to use this global map to show the cervical cancer incidence. So the light blue shows where there's a low incidence, meaning there are not many cervical cancer cases. And you can see places like North America, Australia, Scandinavia, because they implemented their vaccination program against HPV, which is a main cause of cervical cancer. Their incidence as of 2018, which is pre-pandemic, was extremely low. We're in a region where the dark blue, where there's still a lot of cervical cancer. And we are in the same, we have the same sort of incidence as sub-Saharan Africa. So this shows us that we have a lot of work that we need to do in terms of trying to decrease the incidence of cervical cancer. And it also shows the importance of screening, because with screening, we can detect precancerous cells and prevent cervical cancer. So this diagram, I love it just because it shows the female pelvis. So it shows the female reproductive organs. So we have our uterus, which is subdivided into our uterine corpus, or the body of the uterus, as well as the uterine cervix, which is the neck of the womb. So this is where the focus of our presentation is today. So when we do a pap smear, it just gently takes cells from this region here, the uterine cervix, okay? We also have 2 fallopian tubes as well as the ovaries. In order to develop cervical cancer, HPV must be present, all right? So HPV is short for human papillomavirus. I don't know, it's been a buzzword sort of for the last, well, before COVID, it's been sort of a buzzword, HPV, and prevention of HPV, because we've realized that if we could prevent people from contracting HPV, then we can prevent cervical cancer. They sort of go hand in hand. And this buzzing also came about because we have vaccinations to help prevent HPV. There are 2 types of HPV, 2, the low risk type as well as the high risk type. The low risk type causes genital warts. So we call them skin tags. They're usually darker lesions, raised lesions in the vulva, vagina, anus area. And then the high-risk types, they cause cervical cancer. They can also cause throat cancer, penile cancer, as well in men. So HPV is the culprit, and what we really need to focus a lot of our prevention on, preventing HPV. So things that we need to know, especially because the main focus of HPV prevention is in younger children. So trying to give them the tools they need to prevent developing HPV as they get older. So the main things that we need to educate our kids about would be HPV is a serious illness. Even though it's common in our population, it's serious because it can have life-altering sequelae. Additionally, HPV affects both men as well as women, all right? And usually HPV infection has no symptoms, and that's the thing about it. So it's hard to say who's a carrier of HPV and who is not. There are 2 ways to get human papillomavirus, through sexual contact. So technically, HPV is considered to be a sexually transmitted illness, but it is very, very, very prevalent. In a person who has had intercourse with more than one person, the risk of HPV is 80 to 90%. So we primarily get HPV through genital contact and oral genital contact, okay? It can also be passed down from mother to child during labor and delivery. So that's called vertical transmission. So remember I spoke about the focus of prevention. So in general, we can prevent HPV through vaccinations. So there are two main vaccines, the Cervarix as well as the Gardasil. All right. Right now, the government of the Bahamas provides the Gardasil vaccine, which covers 4 of the most common types of HPV. It covers the low-risk types, 6 and 11, and it also covers the high-risk types, 16 and 18. I call them the teenagers. That's how I remember them because they cause the more significant damage, HPV type 16 and 18. We also have the Gardasil 9 vaccine, which is the newer vaccine, and this covers more types. So there are over 100 types of HPV, but the most common types are 16 and 18. But we found in our population, we're not only affected by 16 and 18, we could also be affected by 33, 45. So they're different. Our population has 16 and 18, but there are also other types that are more prevalent with us that we need to cover for. And that's where the Gardasil 9 comes in. Now, unfortunately, this isn't available. This has to be paid for, but this is usually indicated in persons to prevent HPV, as well as people who've had abnormal pap smears. We tend to give them more the Gardasil 9 than the other Gardasil vaccine. So what has the vaccine done? So if we target the correct population, so between 12 to 14 years of age, if we give them the vaccine, what other countries have shown is that you can have more than a 50% decrease in HPV infections. So what does that mean? So we have less genital warts, we have less cervical cancer as a result, as well as the other types of cancers that HPV causes. So it's very, very important that we ensure, and it's also a program that the government is doing, is ensuring that our population is vaccinated against HPV. So when we do our Well Women visits, a lot of our focus is on cervical cancer screenings, particularly between the ages of 21 to 29. So pap smears usually start at the age of 21. So that's a clinical indication, usually the age of 21. And there are three ways now that we screen for cervical cancer. So remember, I showed you this diagram, shows the cervix, and it shows the area where we remove the cells. So it's like a slight brushing, we remove the cells. And there are 2 types now. So we call this one the conventional cytology. So this is a slide. I take the brushings with a cyto brush, as well as we call this the air spatula. So I go in the cervix, take the biopsy, the sample, and it doesn't hurt. It may be mildly uncomfortable, but honestly, it doesn't hurt. And this is somebody who does not like pap smears. So I smooth the sample on the slide, and then I spray a fixative on this. So this is our conventional slide-based pap smear, all right? The newer pap option is the liquid-based pap. So if you go to a developed country, you'll see exclusively use of the liquid-based pap. So this is just an alternative. It's a little bit more. So it'll cost maybe about a $10 difference to get this process. So this one is about $35 or so, and then this one is about $45. So it's a slight price difference. And this specimen is also used to do HPV testing. So what we can do is we can do a liquid slide-based pap or liquid-based pap. If you've ever had an abnormal pap smear, then this is done exclusively. So every single time we come, we have to do a liquid-based pap smear. So screening. Okay, so these are international records. So every country has different screening guidelines. So if you go to the US, if you go to Canada, UK, every single country has their own screening guidelines. But as was previously illustrated, our cervical cancer incidence is much higher than these other places. We have had patients in 2023, so this is not old data, 2023, as young as 25 years old with cervical cancer. So it's happening and it's present, okay? So in general, age 21 to 29, we have a pap smear, either the liquid-based or the slide-based. In age 30 to 65, you could do your annual pap smear, or alternatively, you can do a liquid-based high-risk HPV test. And that will cover you for about 3 years. Once you're over 65 years old, a pap smear is no longer indicated. So you still will get a pelvic exam where the doctor would look at the cervix, check the pelvis, check those other organs, the uterus, the ovaries, as well as the fallopian tubes, but you do not need to have a pap smear. So usually my 65 and oldest, when they come in for their visits, it's a big party, it's excitement because pap smears are no longer mandatory if the last 3 pap smears are normal. So what can pap smears detect? Pap smears can detect precancer and cancer of the cervix. And I really want to focus on precancer because a lot of times patients come in with, and they have an abnormal pap smear. And when we do the biopsy, it shows that they may have a precancerous lesion of the cervix. So precancer does not mean that you have cancer. Precancer means, hey, listen, you have some abnormal cells, we have to treat them, or in the next year, or in the next 3 years, or the next 5 years, you may develop cancer. And I always tell people, you know, my screening test, which is the pap smear, is superior because it's one of the few tests that can pick up abnormal cells before they become cancer. Most other screening techniques pick up actual cancer, but we can pick up abnormal cells and we could treat, freeze, burn, remove, and prevent cancer. So that's what I love about the pap smear. All right. So what can the pap smear show us? So the pap smear can show us abnormal cells, okay? So when I get a pap smear that shows abnormal cells, depending on what it says, then I do a biopsy. So this is a screen. If this comes back abnormal, what I would do is apply different solutions to the cervix and take an actual piece of the tissue. That piece is sent to the lab, and that piece can tell me, listen, either I'm normal, which is what everybody hopes for. It could also show some inflammation that we can treat. It could also show, hey, we have some HPV going on that's causing changes. And the level or degree of changes speaks to how high the risk is of this infection progressing to cancer. So CIN, SIN, are precancerous lesions of the cervix. It's short for cervical intraepithelial neoplasia. And there are 3 types, types 1, 2, and 3. And as with everything else, the higher the number, the more aggressive the changes are. So if you have a CIN1, then with the vaccine, with avoiding those risk factors that we discussed, there's a great chance that you'll go back to normal without any additional treatment needed. However, if you have CIN2 or 3, then your risk of progressing to cervical cancer is greater, and definitely you require treatment, okay? So this shows, I love this slide because it shows an actual cervix. So it's not like a drawing or illustration, it's actually shows the changes that I see when I put the colposcope on the cervix, okay? And then it also shows the changes when the slide at the top, it shows the changes when that slide goes to the pathology lab. So this is what the pink is what I see in office, and this is what the pathologist sees when they look at the cells under the slide. So normal is, and I usually show patients their cervix. So this is what the cervix looks like a little donut. and it's usually pink all around depending on your age, and you don't normally see anything. So when you start seeing white changes on the cervix, this area defect is kind of like exaggeration, that's rarely seen. Or when you see these white changes here, this is when I've applied a solution that shows either A, inflammation, or B, is showing HPV changes. So this is where I direct my biopsy. And then this last slide shows cancer, where you could actually see a lesion. It's usually raised, it's usually angry red. If you touch it, it bleeds, all right? So usually that's the changes that you'll see. All right? If a biopsy is done and it shows cancer, the cancer is usually in an early stage, usually. And these early stages, stages 1 to 2B, usually are localized to the cervical area itself, all right? When stage 2B is when you have spread along the lateral portions of the vagina. So when you see spread beyond the cervix, that's when you get to stage 2B. And that's when you really see a lot of the ill feeling, a lot of the bleeding, the friability, and other changes. So how do we prevent and control cervical cancer and HPV infection? The mainstay is primary prevention, and that's our HPV vaccine. I cannot stress this enough. My favorite vaccine, if I had to choose a vaccine, it's my favorite vaccine. So it can prevent cervical cancer. My oldest daughter is vaccinated, so I'm just waiting for my second daughter to be vaccinated. But essentially, the HPV vaccine helps prevent cervical cancer. The other things, those risk factors that we talked about. So smoking increases your risk for cervical cancer. Diabetes increases your risk for cervical cancer. Also, other sexually transmitted illnesses. So if a patient has herpes simplex virus or chlamydia or gonorrhea, those are called co-infections. So they would increase their risk of cervical cancer. And also using condoms and just engaging in sexually healthy behavior. All right. The next step is secondary prevention, and that's really screening as much as possible and treating as much as possible. So we screen almost everybody. So sometimes patients may not come for well woman visits, but they may come for something else, but they haven't had a pap smear in a very long time or within the last year or two. That's an opportunity to have a discussion about it and say, hey, listen, you're overdue for this particular screening, among others, can we do your pap smear today? And I think that's very, very important and something that we should definitely take advantage of, all right? And then tertiary or third level prevention is treating. So if we see an abnormal lesion, let's burn that. Let's freeze those cells. Let's treat those. And usually if we have to initiate a treatment for precancerous cells of the cervix, then the follow-up is usually a pap smear every 6 months for 2 years. So you've had a pap smear, we do a colposcopy where we look at the cervix, take a piece, it shows some abnormal cells. Those are normal cells are frozen or burnt. Then every 6 months for the next 2 years, in addition to the vaccine, we definitely need to make sure that we're doing our pap smears, we're following up, and we're trying to modify those risk factors. If a woman is diagnosed with cervical cancer, usually, but all the time, they're referred to a gynecologist. That's a gynecologist who deals specifically with cancers of the female reproductive organs. And they will discuss treatment from surgical treatment, chemotherapy, radiation therapy, among others. And one of the mainstays with cervical cancer is abnormal bleeding. So some women would notice, particularly after intercourse, there's bleeding, or their period is not on and they're spotting, those should be sort of red flags. Hey, listen, there's something going on. Let me go into my doc and find out what exactly is going on, because those are sort of in the time I've been doing medicine, that has sort of been like the red flag as to an abnormality with the cervix and possible precancerous lesion of the cervix, or indeed even cancer of the cervix. So any abnormal bleeding in a woman should definitely be investigated, because it could be hormonal or it could be something structural, and cancer is one of those structural things that could happen. All right. Are there any questions for me?
Hi, Dr. Pratt.
Yes, go
Yes,
ahead.
we did
I have
receive a few questions. I'll let Cece go first, and then I'll read the questions that we have received in the chat.
Oh,
Okay.
no, please, I do have a few questions, but please let our guests ask those questions first, please, Chandra.
Okay. All right. So, Dr. Pratt, a question that came in, would you advise females with a history of ovarian cysts to get screened for cervical or ovarian cancer?
So cervical cancer for sure, according to the guidelines, so at least every year between the ages of 21 to 65. Now, ovarian cancer, the studies are not as clear as to what is the best approach to screening for ovarian cancer. So if you have a family history, meaning a first degree relative with ovarian cancer, or you had a previous ovarian cyst, then definitely screening is advised. And usually those screening are pelvic exams. So when you go for your well woman visit, you should have a pelvic exam where, you check the uterus, you check the ovaries, and you look for any bulkiness or any thickness. And another screening tool would be a pelvic ultrasound annually, as well as a test. So that some blood tests that could pick up cancer. So we call them cancer antigen. So there's a specific cancer antigen for ovarian cancer. Now, the cost versus benefit hasn't really been proven for ovarian cancer. So I would definitely say if you're high risk, then definitely engage in more aggressive ovarian cancer screening than the general population.
Okay, thank you for that answer. How often should a 40 to 50-year-old female have an HPV screen or have a pap smear completed?
So overall, it depends on the risk. So if you do an HPV test, then in our population, then you should not need to do a pap smear for another 3 years if it's negative. So once your HPV is negative, then you can do a repeat in 3 years, or you can do a pap smear in 3 years. So in the US, they recommend once every 5 years, but we know we have a bit more HPV. We have different types of HPV, and our risks are just different. So until the Bahamian government comes up with specific guidelines, or the Bahamas Cancer Society comes up with specific guidelines, I would recommend at the minimum for HPV tests every 3 years, and for a pap smear, I definitely recommend annually, because you can see changes within the year. So definitely. Now that recommendation may change as, like I said, my older daughter has the vaccine. So as our younger population comes up and they are vaccinated, then their screening guidelines will definitely be different. But in our current population, and from what I'm currently seeing every day, definitely then they should screen annually with pap smears, liquid-based or cytol or slide-based.
Okay. A lady in the chat is asking, how can I reduce my risk of cancer?
So overall, your risk can be reduced. So the main things are maintaining a healthy weight. So anything that causes oxidative stress or like bad oxygen in the body, we should try and prevent. So taking our vitamins like zinc help a lot. Also, a healthy diet, low fat, lean meats, a lot of greens, maintaining a healthy weight. Those things help to reduce our cancer risk. Specifically for cervical cancer, engaging in healthy sexual activity, avoiding smoking, avoiding diabetes, avoiding HIV disease. So those are ways to reduce our cervical cancer specific risk.
Thank you for those lifestyle behavioral change suggestions, Dr. Pratt. Definitely very helpful. So we have two questions from a male here on the call with us. Is there a cost difference between the HPV test and the HPV high risk test?
So usually you can stipulate what type of tests you do. So in general, when we do HPV testing, we test for the high risk tests. Sorry, the high risk types. So that's a standard price. I'm not sure the exact price, but I think it's in the range of about $200, as far as I know, approximately.
And should males take the vaccine to reduce spreading, the HPV vaccine?
So it's indicated for young men who are sexually naive. So if you're not engaged in sexual activity, then the vaccine is indicated for young men, just the same as it's indicated for young women. Now, I don't know what because I deal exclusively with women's health, I'm not sure what the guidelines, our local guidelines are for men, but men should definitely be vaccinated. But the focus would be trying to reduce the risk and the cervical changes in the women. But the young boys, maybe we'd have to speak to pediatrics and see what their protocols are in terms of vaccinating their boys. I know a few boys whose moms have taken initiative and say, hey, I want to get this vaccine on board for my son, because they realize that men are also carriers and men are also at risk. So they bring them in and they get the vaccine. But in terms of what our national focus is, I'm not sure in terms of the boys. I really can't comment on the boys. But international guidelines state that adolescent boys should be vaccinated for HPV.
Okay, thank you for that, Dr. Pratt. Is there a period where the HPV would lie dormant?
So that's an excellent question. So HPV is extremely common in our population, extremely common. So HPV is something that we pick up and clear. So that's why usually we do not do HPV testing in the 30s and under. Because if I test somebody who's under 30, I expect them to have HPV. But your body's supposed to clear it. You're supposed to get rid of it. So we only have problems with HPV when it persists. So you pick it up through this encounter, but it doesn't clear out of your system. All right, so that's where you have issues and challenges in terms of HPV. So it can lie dormant in the body. So it's hard to say, because sometimes people come with an abnormal pap, and it's difficult to determine, when they would have picked up the HPV. Sometimes if we're immune compromised, like we're stressed out, we're dehydrated, we're not getting the diet we need, it may, flare up, but it's difficult to say. But I find that, and again, this isn't based on a huge population, so don't quote me, but I find that when people are transitioning between relationships, that they tend to have abnormalities with their paps, because you're going from one partner to a new partner, so that that's sort of different environment, etc. But I can't say, it's like with STIs, people say, oh, when could I pick this up? I can't say exactly when. I could say, okay, your last test was in 2023, and at that point you were negative. But I can't, and between then and now, you would have picked it up. But if you would have had never been screened, I can't say when exactly you would have picked it up. So I say, don't kill anybody. Don't go and fight nobody. I cannot say.
Thank you for that.
Every day.
Question,
Behaving lives every day. That's my focus. Don't fight.
So that clarification is definitely important, and I liked how you broke down the scenario, Doc. Our bodies are ever changing, ever evolving, and so sometimes it takes a little bit longer, depending on your environment, for things to manifest. And so that would have been the extent of the questions that we have received from Facebook and Zoom. Cecilia, I'll turn it over to you.
Yeah, good afternoon, Dr. Pratt. I do have two quick questions. One is, and I know there were technical challenges on the front end. We hear a lot about breast cancer, here in the Bahamas, and the fact that we have a high percentage, disproportionately. Is that the same for cervical as well? I didn't know if is that what your earlier slides, I saw some maps, but I didn't know what you were speaking to.
So definitely. So because we are behind, like we're about 20 years behind, not 20, let me not say that. We're about 15 years behind on the uptake of HPV vaccine. So our population isn't generally protected against HPV, which causes cervical cancer. And just our genetics, just being Afro-Caribbean people primarily, our risk for certain things are a little bit higher. And because we have a different type of HPV, so like I said, there are over 100 different types of HPV, and our type of HPV is a little bit different from other population. So depending on where you are, if you're in Canada, you have a certain type of HPV. If you're in the Bahamas, you have a certain type of HPV. So regionally, the HPV serotype changes. So I don't know, like I said, because, and maybe I need to do all these research, but because, we don't have that research backed by, the scientific formula and everything, it's just speculation. But we do have aggressive types. And like I said, we've had people within the past year, 25 years old, with cervical cancer, and that's definitely rare. And you've had people who have had normal pap smears, and the following year, they have, hey, why is this lesion bleeding? And it's cervical cancer. So definitely, I'd say we have well, we for sure have a higher incidence of prevalence, and we also have, I think, more aggressive types of HPV.
Understood. Understood. And my second question is related to the vaccine itself. Obviously, the little bit of research I did, more often than not, it's not recommended for anyone over the age of 26. Is it just a less effective vaccine for those of us who are more mature? And why is that?
So it's just you want to get the vaccine on board before any exposure to HPV. So that's why it's not recommended after the age of 26, but that's purely for prevention. So if you're looking at just preventing HPV infection, then the age, because actually the age was up to 18, but I think in the last 5 years or so, they would have increased it to 26. But it's
and I almost made it. I'm just kidding. I'm just kidding.
But in terms of prevention, then that's the recommended age. But like I said, if anyone has an abnormal pap smear, automatically they get this vaccine, because it can also help to treat and prevent the illness or progression. But just because I had an abnormal pap, I tested positive for HPV, but I may have HPV 16, but there's also HPV 18, 30, 40. So this is where this comes in. So, I really, really fight for my 26 pluses to get this vaccine. And then you have people in the population who are 26 who are sexually naive and they need the vaccine. So it's just a lot of guidelines are based on what are the most cost-effective benefits. So it's more cost-effective to give it to younger, sexually naive people, but there's also benefit in outliers in the group as well. So I got because of the onboarding of HPV, I got my vaccine at 30 plus. I was barely 30. I'm kidding.
I know, I can tell.
I was over 40 when I got it, but the benefit and the efficacy is still there,
Understood. Okay, thank you for that.
You're welcome.
Sean, do we have any other questions?
No, we have no other questions.
Okay. Well, Dr. Pratt, it's amazing that you have a thriving practice, and you have 3 daughters and a whole zoo. You take care of all those animals that she listed, and you made time for us today. Being one of those definitely super women, I see in you. This was extremely informative, educational. I know for me personally, and based upon the questions we had, even with men, normally you don't hear men speak up and inquire. But this was certainly, I think, an area of cancer. As I mentioned before, you hear about breast cancer often, you hear about prostate cancer, but some of these other cancers that are just as prevalent that we aren't educated on. So for you to take the time today to do your part is certainly appreciated, and we're grateful. So thank you.
Thank you so much for having me. It's one of my favorite topics. I love everything about preventing cervical cancer, because it is a modifiable disease process, and we can prevent it. I tell people, I believe before I retire, that this will not be a major concern because there's so many ways to prevent cervical cancer. So I'm looking forward to the day when we have no cervical cancer cases.
Yes,
And
speak it.
update.
Speak it. Chandra?
Yeah. Thank you again. And so this afternoon, we want to, before we dismiss the call, I know we have quite a number of beneficiaries that would have logged on, and that's also Zoom logged on via Facebook Live. And so our beneficiaries tip for the month. Annual wellness visits are offered free of charge to NHI beneficiaries. And this visit would cover things like your health history, obtaining your vital signs such as your height, your weight, your blood pressure, your temperature, your breath rate, as well as your oxygen levels. A physical assessment and examination by your physician, pap smear testing, and you would have touched on that today, as well as routine blood tests. And your laboratory blood testing is free under the NHI Bahamas program at an approved NHI laboratory. And so for those of us that have not booked our annual wellness visit for the year, we are heading into the month of February, and so we still have time to do that. And Dr. Pratt's information that she would have given us this afternoon, particularly on the pap smear testing, ensure that your pap smear test is completed during your annual wellness visit. Please advocate for your health. Ensure that your vital signs are taken. Ensure that you provide your doctor with the accurate health history, so that they can also better serve you. And ensure that your physical examination and assessments are taking place. These are things for females. Make sure that the physician examine your breasts. Some physicians like to examine your abdominal section. So make sure that your doctor is also hands-on, your physician is hands-on with your annual wellness visit experience. And so this is our tip today provided to you by the National Health Insurance Authority. And so what's happening? Every third Thursday on February 22nd, our first power hour for the year will be held. And so you can join us for a monthly complimentary power hour session. Our beneficiary educational sessions are also hosted on a monthly basis in a virtual and or face-to-face environment. And then our farmers market is hosted on the fourth Thursday as well. And we offer a variety of homegrown and homemade products locally. And so stay tuned to our Facebook pages, our Instagram pages, as well as to your emails. We are very active on our social media platform. And so we hope that you can join us on February 22nd in the parish hall at the Holy Cross Anglican Church for a time of Zumba fitness with William Saunders. Good afternoon, everyone. Feel free to contact us if you need us via email, info@nhibahamas.gov.ds, via telephone at 396-8500, and on our social media platforms, Facebook, Instagram, LinkedIn, and Twitter. And then definitely you can log on to our website at www.nhibahamas.gov.ds. Again, thank you. Have a wonderful afternoon. Dr. Pratt, thank you again so much for your wealth of knowledge. Have a great day, everyone.
Bye.
Good afternoon. Thank you, Dr. Pratt.